Congress is attempting to push through a disastrous partisan bill that would deliver a handout to multinational corporations on the backs of middle-class Americans. Not only is this scheme, this tax scheme, going to hurt the paychecks of our people, it's going to make their health care worse. And I was especially struck yesterday that the president said a very tiny little sliver of Americans would be worse off under this legislation. And that's a verbatim quote from the president yesterday. When you hear tiny little sliver, you might think of how much dessert you asked for at Thanksgiving, not major changes to the health care of the American people. The changes that the Senate Republicans have put in their bill, that's not a tiny little sliver to 13 million Americans who won't have health care. It's not a tiny little sliver in terms of the extra costs that Americans are going to have to pay for. And it's certainly not a tiny little sliver for the millions of Americans who have pre-existing conditions, who are going to get clobbered once again with higher costs and off-market plans that mark a return to the dark days when rescinded coverage, denied claims, and junk insurance ruled American health care. For half of all Americans with a pre-existing condition, health care is not a nice to have, it's a need to have. Being priced out of the insurance market means someone with diabetes will go without insulin, which has doubled in price in the last few years. And we heard a lot about choice during this debate. What do you tell somebody with diabetes who needs insulin every day? Is this really a choice for half of Americans who have a pre-existing condition? The fact is, the Republican bill is a dagger in the heart of the Affordable Care Act and private markets that the president claims to be a strong supporter of. It's going to threaten millions of Americans who are eligible for Medicaid but don't enroll, likely because they may not know that it is even an option. And there are people who are going to miss out on crucial health care, preventive care, treatment for opioid addiction. Bottom line, the bill trades the health of a lot more than a tiny little sliver of middle-class Americans to pay off the multinational corporations and the well-connected. And the consequences for Americans' health care and other basic assistance doesn't end there. Republicans have made it clear that after they've blown through the $1.5 trillion hole in the deficit, they're going to claim, oh my goodness, we've got this big deficit. What are we going to do? Well, Paul Ryan said yesterday that he's going to go after basic assistance that, again, millions of Americans need. This means an attack on Medicaid along the lines of what the American people witnessed earlier. They'll say Medicare spending is out of control while corporate stock buybacks accelerate to new heights, and we continue to see middle-class wages stagnate. Suddenly, they'll say, well, maybe we ought to be raising the retirement age, claiming older Americans can afford to wait a few more years. Anti-hunger, anti-poverty efforts are going to take a hit as well. So you're going to hear a lot of lingo about entitlement reforms and welfare reforms, but we believe the public really understands. After saying that you can have $1.5 trillion in tax breaks for multinational corporations, we believe what's coming next is an attack on America's lifeline, on our safety net, the bedrock social compact. We're going to fight it. We're going to fight it every step of the way, and I'm especially glad that we've got an outstanding member of the Senate Finance Committee who's been a partner of mine going back to the days in the House of Representatives, and Senator Cardin will speak next.
Thank you. Well, first, let me thank Senator Wyden for his extraordinary leadership on this issue as our leader on the Senate Finance Committee. We also will be joined by Senator Bennet, who has been just so articulate as to the dangers of this tax bill, not just on the health issues, but on so many other issues. And we're glad that we're joined here today by people who are on the front lines of our healthcare system, and we thank them all for being here, including those for Doctors for America, Little Lobbyists, Center for American Progress, Veterans for Maine, but particularly want to thank Charlie for being here. Because Charlie is the one who is going to be left holding the bag here as to her health care moving forward and paying the debt that would be created if this tax bill becomes law. Now, Senator Wyden said it best, that this bill will create major, major problems. For the 800,000 Marylanders who will end up paying more taxes under this bill, that's not a small number in my state, Senator Wyden. As you point out, that's a large number. And for the 13 million Americans who are going to lose their health coverage as a result of this bill, that's not a small number. This is not our first attack by the Trump administration on health care. It started with actions taken by President Trump to deny the payments for the cost sharing, for speaking out against the enforcement of the system itself, inadequately funding those that are help people to enroll in the system. You put that all together, and we've seen an uptick in the number of uninsured in this country as a result of actions taken by President Trump. Now we have the second installment on a plan that will hurt health care in this country, and that's this tax bill that's moving through conference now that would remove the individual responsibility and add 13 million to the uninsured. This will have a direct impact on health care in our community, not just the 13 million, but as I pointed out on the floor of the United States Senate, when these 13 million start using emergency rooms rather than using their family doctors for preventive health care, you're going to have people enter the healthcare system in a much more costly way, a much more critical way, and not able to pay their bills. We all are going to end up paying higher premiums as a result of this bill if it becomes law. And quite frankly, it's not the last installment, because if this bill becomes law and you have a $1.5 trillion deficit, and by the way, even with dynamic scoring, as Senator Wyden has pointed out on the floor of the Senate, there'll be, even with dynamic scoring, which is using a magic wand, there's $1 trillion in deficits. We think when you extend all the provisions, you're looking at over $2 trillion in deficits. And why do I mention that? Because obviously I should, because we shouldn't be adding to the deficit. But it affects the healthcare system in this country. Because as Senator Wyden pointed out, the Republicans' next chapter will be, oh, we got these deficits, we got to do something about it. Let's cut Medicare, let's cut Medicaid. But there's even an automatic system that will be kicked into place known as PAYGO that will automatically trigger, as a result of this bill becoming law, if it becomes law, it will automatically trigger cuts in health care expenditures in Medicare. So this is not the last assault, and the numbers will continue to go down from the point of view of those having adequate coverage for health care as a result of the passage of the bill. And that's not the end of it, because there's another chapter that's going to hurt the health care in this country, and that's what we're doing to our states. Our states are trying to come up with innovative ways to deal with the health care problems. And in my own state of Maryland, we have a unique program with our hospital community where they're now engaged in what's known as an all-payer rate structure, which is, I'm not going to get into the details of that, but Maryland's the only state that's working under now a demonstration program with CMS, where we are committed to bringing down the overall cost of hospital care in our state below the national average by an innovative model. But I can tell you, it can't be done if the uninsured rates go up. And that's exactly what this bill will do in Maryland, will increase the number of people without health insurance. So what we're doing in Maryland to keep health care costs rates reasonable is being jeopardized by what's being done here. So for health care and for many other reasons, this bill is a disaster for this country. And for Charlie's sake and for the sake of millions of Americans, let's get this bill back in committee and let's work in a bipartisan way and let's do something positive on health care, such as we've seen from Senator Murray and Senator Alexander, and just shelf this attempt to hurt health care in America. And with that, I'm going to turn it over to Dr. Saram from Doctors for America.
Thank you, Senator. Good morning. My name is Dr. Sanjeev Sriram. I am a member of Doctors for America and a pediatrician in Southeast Washington, D.C. My patients are struggling to survive the Trump administration and the GOP Congress. That is not hyperbole or exaggeration. The GOP tax scam is yet another assault on the health care of my patients and their families. All year long, the Republicans have attacked the ACA and Medicaid with no regard for the millions of everyday people who will suffer. Let me tell you a little bit about my patients. They are children struggling with poverty just a few minutes away from where we're standing right now. I worry about their survival because politicians in Congress are not prioritizing their basic human right of health care. Rather than extend CHIP and give my patients' families peace of mind about their children's coverage and health care, Republicans have prioritized huge, unnecessary tax cuts for the super rich. If the GOP tax scam becomes law, the federal deficit will explode. My patients will suffer even more because their federal government will tell them it cannot afford basic necessities like health care, nutrition, and housing. But that is a lie. We can afford all of these things when we stop giving enormous, unnecessary tax breaks to billionaires and big corporations. The parents and grandparents of my patients are working hard, often at multiple jobs, just to make ends meet. Senator Hatch, they are not just lifting a finger to help themselves, they are lifting all their fingers. They are sweeping floors, serving coffee, stocking shelves, working security, pouring drinks, waiting tables, and contributing to comforts and cleanliness for their fellow Americans. They are pinching every penny they earn, Senator Grassley, not spending it on booze, women, and movies. Patients and families across the country need Congress to support Medicaid, Medicare, and the Affordable Care Act. The Senate version of the GOP tax scam repeals the individual mandate to have health insurance. 13 million people will lose coverage. 5 million will lose Medicaid. And premiums will skyrocket for millions more. To make matters worse, the GOP tax scam causes enormous deficits that will trigger major tax cuts to Medicare. $25 billion in the next year and $400 billion in the next 10 years. Patients will die. That is not an exaggeration. After the 2013 sequestration cuts, Medicare lost funding, and elderly cancer patients needing chemotherapy were turned away by doctors and hospitals. Under the GOP tax scam, Medicare loses, and so do patients and families. What does Congress want us to do? Is GoFundMe now how they expect all but the super rich to pay for health care? We do not need this tax reform. We need to reform our attitudes toward children and families with low incomes. We need to treat health care like the basic human right that it is, regardless of a person's income or employment status. Doctors, patients, and families have a very clear message for Congress. Stop the GOP tax scam. We will not sacrifice health care for wealth care. Thank you.
Well said, Doctor, and Senator Cardin and the good doctor have said it very well, and they were terrific speakers, but frankly, I'm not close to the influential voice of the little lobbyist. So let's have them come on up, and Charlie, I think you might participate a little bit too, but let's just turn this over to the little lobbyist.
Hi, I'm Rebecca Wood. I'm from Charlottesville, Virginia, And this is Charlie. You say hi? Hi. She's going to hang out with Elena for a minute. Okay. Out of the many ways the tax bill will negatively affect my family, the scariest to me is the effect it will have on Charlie. Due to preeclampsia, Charlie was delivered via emergency C-section 10 hours into her 26th week of gestation. Okay. She weighed 1 pound, 12 ounces, and was the size of my hand. I kept a constant bedside vigil because I did not want her to die alone. It's all I could do for her at the time. Charlie was strong and a fighter. 3 months later, she was discharged from the NICU. However, it was not over for us. She had significant sensory issues along with speech and motor delays. An army of specialists watched over her while she was enrolled in services like OT, PT, and speech therapy. She learned to walk, gained the use of her hands, and developed the ability to speak and say, "Mommy, I love you," the sweetest words to my ears.
Hey, let's hear it for
Oh my God. Yet again, Charlie overcame seemingly insurmountable obstacles. Now, Charlie has an excellent chance of a typical independent adulthood as long as she continues to receive services. Charlie's extensive medical care is possible because she has a Medicaid waiver. The waiver helps with the out-of-pocket expenses such as co-pays, deductibles, and cost-sharing expenses left over from my husband's employer's coverage. I would not be able to afford most of her medical care otherwise. After everything she's overcome, this tax bill is robbing her of her chance. It's stealing her future. The bill is not only bad policy, it's morally wrong. This fight is bigger than partisan politics. It's about people's lives and my child's future. She's my baby, and I won't stop fighting for her.
Well said, Rebecca. What I think we'll do, we'll hear next from Sam Berger, the Center for American Progress, and Jim Betts. And then we've had the good fortune to be joined by Senator Bennet, so we'll have Senator Bennet wrap it up and take some questions. Sam?
Well, first, I'd like to just thank the senators for their tremendous work fighting and succeeding in fighting the first attack on healthcare that we saw, and their efforts to fight this attack on healthcare. Because make no mistake, this tax bill is an attack on healthcare. Attack on healthcare today, and attack on healthcare tomorrow. So the today part, it repeals the individual mandate. The Congressional Budget Office tells us that means you'll see 13 million more people uninsured by 2025. You'll also see premiums go up 10%. Give you a sense of what that means. A typical American family buying insurance on their own will see their costs raised by $2,000 in 2019. It'll also cause consternation among insurers who will have an uncertain market with prices fluctuating. Many of them will choose to leave. That's going to constrain consumer choice, particularly in rural and underserved areas. But it's not just today that we're going to see these health care cuts. There's also going to be an immediate attack on Medicare. Because this bill costs between $1 and $1.5 trillion, we're going to see automatic cuts to Medicare next year, $25 billion. I just say that again, $25 billion. Over 10 years, $400 billion in Medicare cuts. We also know what we're going to see next in terms of the Republican agenda. They're going to come back and tell us, well, look, revenue's down, of course. Spending's too high, so what do we need to do? We need to cut Medicare, and we need to cut Medicaid. Paul Ryan's already said as much, but we don't just have to take his word for it. Look at the health care bill. It cut over $800 billion from Medicaid in order to give tax breaks to insurance companies, the wealthy, and drug companies. So we have on one hand a health care bill that cuts the taxes for the wealthy, and a tax bill that cuts health care for the middle class. When you look at it all together, it's pretty clear that Republicans view middle class health care as little more than a piggy bank to fund tax cuts for the wealthy, their donors, and corporations. That's why we need to fight so hard today against this tax bill and be ready for future fights, because no matter what happens here, they're going to keep coming for people's health care, and we need to keep being there including the little lobbyists and others, to fight back and say no. Healthcare is a right in this country, and we don't want you to be taking it away from folks to pay for tax cuts for those who don't need it.
Well said, Sam. We're really lucky to have a strong voice for veterans, and Jim Betts, and just go ahead, Jim.
Thank you. I'm Jim Betts. I retired from the Maine State as a Maine State worker and a military veteran. My wife and I raised 4 adult children, and my wife, with multiple sclerosis and my severe asthma, rely on Medicare for our health coverage. This tax bill would threaten our health care. Republicans have been very clear that they want to put Medicare, Medicaid, and Social Security on the chopping block to pay for tax giveaways for corporation billionaires and millionaires. Our kids would be hurt too. They're paying off college loans and would lose the ability to deduct that interest from their taxes if this bill becomes law. Republican priorities are all screwed up. They should be focused on raising wages and strengthening health care, not passing massive tax breaks for millionaires, billionaires, and big corporations at the expense of working Americans who are trying to put food on the table and sending their kids to college and saving for retirement. I came down to D.C. to deliver that message to my members of Congress. Senator Collins and her colleagues need to do the right thing and oppose this bill. If they don't hear from us now, we'll make sure that they hear from us at the ballot box.
Jim, thank you. And obviously, Maine is very crucial in all this, and we really appreciate it. And joining Senator Cardin as a particularly passionate voice for folks, working families, seniors, the vulnerable, like the little lobbyists, and batting cleanup is Senator Michael Bennet.
Thank you, Senator Wyden. Senator Cardin, it's wonderful to be with you and all of you. And I think our little lobbyist is going to sleep right at the moment she should, which is when I'm beginning my remarks. All year the Republican majority has tried to jam through tax cuts masquerading as a health care plan. And when that failed, they tried another approach to jam health care cuts masquerading as a tax plan. According to the nonpartisan Congressional Budget Office, the Republicans' plan would cause 13 million Americans to lose their health insurance. It would also raise premiums on the individual market by 10%. In my state of Colorado, there will be 235,000 more uninsured people in 2025, and because of the hole this bill is going to blow in the deficit, we now have to worry about cuts to Medicare and Medicaid. This bill would trigger a $25 billion cut in Medicare alone. Republicans are telling those making more than $1 million a year that they need a huge tax cut, while telling seniors, kids, and some of our most vulnerable citizens that the programs they rely on are in jeopardy. At the same time, the CHIP program that covers 90,000 kids in Colorado expired in September 30th, and we're told that they can't find an offset for CHIP at a moment that they're blowing a $1.4 trillion deficit into our balance sheet. This is just the latest in a string of attempts by congressional Republicans and President Trump to take away people's health care in America. Since 2010, the House of Representatives has voted over 60 times to repeal the law while offering no serious alternative to the American people. This year in the Senate, Republicans tried 4 separate times to repeal the Affordable Care Act and replace it with proposals that cut taxes for those making more than $1 million a year while cutting health care for the most vulnerable people in our country. And during his campaign, candidate Trump promised that people are, quote, going to end up with great health care for a fraction of the price. Upon taking office, President Trump blocked efforts to enroll more Americans on the health care exchanges, and despite bipartisan opposition, he halted payments that help working Americans buy health care. Then he said he would allow insurance companies to offer plans that no longer cover essential health benefits, such as prescription drugs. For people across Colorado and the country, health care is about caring for a sick child or an elderly parent. It has nothing to do with politics. And it's not too late for Senate Republicans to listen to the American people's needs and work with us on solutions, rather than harmful legislation written in secret without any input from the American people.
Thank you, Senator Bennet. Let's throw it open to questions. I know you've heard from a variety of speakers. Press folks have any questions?
Yeah, at this point, Senator Wyden, what are the odds that the tax bill that's in conference won't pass? I mean, is it pretty slim?
First of all, I think it's very clear that they have a lot of challenges in terms of moving this legislation. You can see they're still debating, for example, what to do about state and local taxes. Senator Collins apparently was told that she was going to be able to secure a commitment on Alexander Murray and the Collins-Nelson bill, and you've seen what the House of Representatives has had to say about this. Senator Corker certainly has not indicated that he's changing his position. So one of the reasons I believe they're trying to move so quickly, and you have seen from the White House early statement that this would maybe be around December 20th, 21st. They're trying to move now at the speed of light because their numbers don't add up. Their members can't make a case to middle-class people. You've seen their horrendous polls. I just had 2 town meetings at home in Oregon, one in a place that Hillary Clinton won, one in a place where Donald Trump was very popular, and the reaction was horrendous in both places. I want to give my colleagues a chance to talk, but I can tell you, I think it's clear that what they thought was going to be, we'll get this done lickety-split. Now they're starting to see that their numbers don't add up. Ben or Michael, you want to add anything?
I would just point out, it's been coming out since the passage in both the House and Senate, they got major problems in this bill, major problems. It will be a total embarrassment if it becomes law. And I think the Republicans are starting to understand that. And it takes time to figure out how to fix the mistakes that they made. The fundamental problem, of course, it's not helping middle-income families, it's hurting middle-income families, and it's blowing a real hole in the deficit. And then they brought the health care issue in here so they could get more money to give corporations permanent tax relief. That's fundamental flaws that need to be corrected, but there are so many other flaws that we hope that the American people will speak out and that we will see this bill return basically to committee for work. Now, the chances, we'll see.
Michael, you want anything? No. Okay, any other questions? Yes.
In terms of the PAYGO cuts, I know that they have been promised, some of the Republican senators that are concerned about those, they'll be able to waive certain PAYGO cuts. Of course, that would depend on cooperation from Democrats. But I was wondering what's the status of things on your side? Has there been any communication with Republican senators who are concerned about that, to the fact that Democrats would sign on to that before months?
Let me be blunt with respect to PAYGO. We are not going to play a game of chicken with Republicans. We're going to do everything we can to stop this badly flawed scheme that would steal billions of dollars from Medicare and hand it to very powerful corporate donors. The bottom line here is Republicans need to stop punishing the middle class and stop pushing the middle class and seniors towards a cliff. That's where we are in PAYGO. Yeah.
Senator Wyden, is there anything that Democrats can do while the House is, or while the bill is in conference to protect or repeal the individual mandate?
Well, we're certainly going to be using every opportunity to get out what this really means. It's why I was really struck yesterday when the president said only a tiny little sliver of Americans would come out worse off. I think you're hearing from lots of people, we're not talking about a tiny little sliver. We're talking about millions. And I spoke on the floor about it yesterday. Senator Bennet, Senator Cardin have been, outspoken. I think this issue is still very fluid. The Republicans have some major challenges, which we've documented. I mean, they're still trying to sort out what to do about the alternative minimum tax, and there's great frustration among some business people with respect to losing the research and development tax credit. By the way, the research and development tax credit is used to pay wages for innovation-related businesses. So I think they've got got some real problems on our hand, and maybe Senator Bennet wants to mention it, but this is far from over. And I think they've realized that this bill is going to face some real challenges. Any others?
Yes, Senator Wyden, you worked closely with Senator Hatch to get the CHIP bill through committee in the Senate. It was brought up, kind of the controversial remarks and just kind of where the bill stands now, which is, can you just comment on that?
First of all, I think we ought to put this a little bit in context. Somehow there's time for a $1.5 trillion tax reduction for multinational, corporations, but when we're talking about 9 million kids and them having affordable, health care, somehow that's just kind of an afterthought, and that's not our view. If I had had my way, we would have moved the CHIP bill weeks and weeks ago. But the fact is, the Senate Republicans have put this array of tax handouts for the multinational corporations way ahead of the needs of youngsters and families on CHIP. I mean, this area and the topic that you're talking about reflects as clearly as anything priorities. Budgets are not just charts and graphs and numbers. They're really about what's in your heart. And it's clear that the Republicans have said that hundreds of billions of dollars in cuts for multinational companies is a lot more important to them than CHIP. We don't share that view. And if we had had our way, we would have passed it weeks and weeks ago rather than having to kill the flawed Graham-Cassidy bill.
I have one more question.
Yeah.
Last week I spoke to Senator Thune, who told me, what Democrats are saying about how the tax bill affects health care isn't true because the only thing in the tax bill about health care is the repeal of the individual mandate. Can you just kind of respond to that?
What's important, and it's why I went through the people who would be hurt who have pre-existing conditions. Without some kind of purchase requirement, you can't have the loophole-free protection for people with pre-existing conditions because it's not possible to really price the product. So by taking out the personal responsibility part of the Affordable Care Act, or the coverage requirement, if you want to call it that, you unravel protection for the millions of people with pre-existing conditions. And some of you in the press corps are already reporting about how indications are that not only will it do that, but it will fast track the return of what are called junk insurance policies, where you have these short-term policies, significant broker commissions, aren't worth the paper they're written on. And so I know the Senate Republicans have gone to great lengths to try to say, well, we're only doing this one piece of the Affordable Care Act. What we have tried to make clear, and I've done it on the floor a host of times, that purchase requirement, the coverage requirement, is directly linked to making sure that healthcare in America doesn't go back to the days when healthcare was for the healthy and wealthy. During my days when I was co-director of the Oregon Gray Panthers, we saw that the insurance companies could beat the stuffing out of people who had a pre-existing condition. And so when we wrote our bipartisan bill, the Healthy Americans Act, at the center was loophole-free protection for people who had a pre-existing condition. The Republicans are happy to unravel it, go back to the days when health care was for the healthy and wealthy, and all these wonderful people, and Senator Cardin and Senator Bennet and I and Senator Democrats are going to fight them all the way. Thanks for having us. Oh, well, I'll take one last one.
A question about the CR. I think we're only about 2.5 days away from funding running out. Do you expect to support and potentially grant UC for a CR that simply moves the date to December 22nd, or are there things that you need to see involved in that, such as CHIP or Alexander Murray?
Well, we're not going to front run our colleagues, here. Obviously, we want a balanced, bill. We've been particularly concerned about the safety net programs. I mean, here we are facing the prospect of losing health benefits as part of the tax plan, A. B, Paul Ryan has already made an announcement that after contributing significantly to the deficit with a badly flawed tax plan, he's coming right after the safety net, which means Medicaid and Medicare and Social Security. So we're obviously very concerned about those lifeline programs, safety net programs as part of any continuing resolution, and I'll obviously have more to say about it down the road. But what I'm thinking about, and I'll speak for myself on this, is really a triple whammy. Hits on health care in this tax bill, Paul Ryan's upcoming plans, and then obviously we've got to be concerned about what's in the CR. Thanks, everybody. Doctor, you nailed it.
Oh, thank you,
Great.
sir.
Charlie, give me 5. There's multiple.